Today, my presentation is on Grey's Anatomy, Season 2, Episode 26. First, I want to start off with the character involvement. You have your two main characters, Dr. Izzy Stevens and patient Denny Duquette. Then you have Dr. Meredith Grey, Dr. Christina Yang, Dr. George O'Malley, and Dr. Alex Krev. These last four doctors are the ones who helped Izzy with her unethical decision. I am now going to discuss the episode background. Izzy is Denny's doctor at Seattle Grace, but she has recently fallen in love with Denny. Denny is on the heart transplant list and is supposed to receive a heart, but someone was placed on the transplant list seconds before. Izzy, who is in love with her patient, decides to take matters into her own hands and has a plan to get that heart for Denny. Denny was refusing the effort until Izzy convinced him. Izzy stands in Denny's room at Seattle Grace Hospital with the cut LVAD wire in her hand. George, a fellow attendee at Seattle Grace, says they need to call code blue. He can't feel a pulse. Izzy stops him and says she has a plan. If they call a code, Denny will be rushed into surgery and they'll replace his LVAD. Then he'll stabilize and he won't get the heart. Denny will die waiting for another heart. George says this is crazy. Izzy threatens to break George's bones if he calls the code. Izzy says he has to choose between leaving and helping her save. Izzy stands in Denny's room at Seattle Grace Hospital with the cut LVAD wire in her hand. George, a fellow attendee at Seattle Grace, says they need to call code blue. He can't feel a pulse. Izzy stops him and says she has a plan. If they call a code, Denny will be rushed into surgery and they'll replace his LVAD. Then he'll stabilize and he won't get the heart. Denny will die waiting for another heart. George says this is crazy. Izzy threatens to break George's bones if he calls the code. Izzy says he has to choose between leaving and helping her save. While Izzy is ventilating Denny, Meredith comes in to answer George's 911 page. George says they need help. Christina then comes in and wonders what the heck is going on. George then proceeds to tell them what Izzy did. Izzy explains her plan. Izzy says everything will be fine when Burke gets here. But then Christina drops the news that Burke had just got shot and that he is not getting the heart. Caring for patients at the end of life is a privilege. Physicians have a responsibility to help patients to find their goal for care and to respect patients' preferences. In general, physicians should not treat themselves or members of their own families. Physicians who are employed by businesses or insurance companies or who provide their medical expertise in sports should protect the health and safety of their participants. Protecting the rights and interests of both organ donors and transplant recipients is essential to the life-saving goal of organ transplantation. Izzy violated this goal of ethics by treating the love of her life. Her judgment was impaired by her need to have him survive. She loved him too deeply to acknowledge his true needs. He was at the end of his life. He begged her to stop and let him go. He had clear goals that her love for him blinded. Organ donors have a very quick timeline. My own aunt this past month had 36 hours to show she had been following the plan to receive an organ. Match her tissue type, arrive at the hospital ready for her transplant. She had no idea why or how this organ became available, but it was truly life-saving. She had to be honest and determined to be someone who could receive this organ. As a result of Izzy's unethical decision, she later on lost her job once the chief of the hospital found out it was her who cut Denny's LVAD wire. On the other hand, Denny got the heart, but a little after surgery, he died of a stroke because of a blood clot that he was prone to, but Izzy was so love-blind to remember. All the other doctors involved in helping Izzy were all punished for not ethically thinking right about what they were doing. Here is a quick short 2-minute video of the episode. Thank you for watching my presentation. I hope you enjoyed it.